occupational therapist at Thompson's Linwood location. Today I'm going to be talking about epicondylitis, the different types, and introduce an example of a therapeutic program that can be used to help with reducing the symptoms of epicondylitis. There are two types of it. There's lateral epicondylitis, which is also known as tennis elbow, and there's medial epicondylitis, which is also known as golfer's elbow. They're both painful conditions that are caused by overuse. Over time, the forearm muscles and tendons become damaged from repeating the same motions over and over again, and this leads to pain and tenderness around the elbow. Medial epicondylitis is tendinosis of the medial epicondyle on the inside of the elbow, and it most commonly involves the tendons in the forearm called the flexors. Lateral epicondylitis is tendinosis of the lateral epicondyle on the outer part of the elbow, and commonly involves the tendons in the forearm called the extensors. The therapeutic exercise program that you're about to see can be used for both types of epicondylitis, as it works to stretch and strengthen the muscles attached to the injured tendons to facilitate the healing process. The early goal of the program is to promote muscle endurance and improve resistance to repetitive stress. We're pairing the program with electrical muscle stimulation to help manage the patient's pain. Transcutaneous electrical nerve stimulation, or TENS, is being used as a sensory level electroanalgesia, which serves as a non-pharmacological therapy for the patient's acute pain in the elbow. It is also important to note that TENS has no adverse effects when it is used properly. Since we're going to be using TENS as a pain management technique, we want to keep the intensity at a sensory level. This means turning the intensity to a point of producing a muscle twitch and then backing off slightly. For example, if a twitch is elicited at level 10, then we're going to go back to 8 or 9 where there is no twitch present. The goal is for the stim to be a strong but tolerable tingling sensation, so it is important to check in with the patient as well. Research does suggest that the greatest analgesia is produced when a stronger tingling sensation is felt, but again, this is going to depend on the patient. It is also common for accommodation to occur during treatment, so the intensity may need to be turned up slightly throughout the session to prevent habituation and also maximize analgesia. There has been research in recent years that suggests TENS effectively reduces pain associated with movement, so incorporating movement or functional activity like you're going to be seeing today with the electrical stimulation, when appropriate, it is highly beneficial. The demonstration you're about to see is with a patient named Barry. Barry came to us with medial epicondylitis due to his love for playing golf. He presented with a 5 out of 10 pain at the first visit, and at this time he's experiencing a pain level of 1 out of 10. He has also been able to still participate in golf throughout our treatment, so he's extremely happy with how everything's been going. So this is Barry. He has been experiencing pain around the medial epicondyle, which is the inside of the elbow. Barry's dealing with medial epicondylitis, also known as golfer's elbow, and Barry also happens to be a golfer. So the repetitive motion is causing that overuse in the forearm muscles, and the tendons, specifically the anterior forearm, which is right here across the flexors. So where I have his stim pads is just to kind of bracket the pain that he is having, which is right in here. And so the first two exercises that we're going to be doing are going to be wrist flexion and wrist extension stretches. So to start, Barry, I'm going to have you put your arm out like you're holding up a stop sign, and you're going to use the other arm to gently pull back on the fingers until you feel that stretch on the upper part of the forearm. We're going to hold it for 15 seconds and then relax. And we do that 5 times. The next one we're going to do is the hand's going to go down, and then again you're going to use that other arm to put gentle pressure across the front. And again, you're going to hold it for 15 seconds and repeat it 5 times. So next we're going to do wrist extension strengthening. So Barry, I'm going to hand this to you. It's just a 2-pound weight. What you're going to do is relax the arm, and I want you to hold up for a count of 1, and then we're going to slowly lower for a count of 1, 2, 3. And then we'll return to that neutral and back up for 1, and then slowly lower 1, 2, 3. And we do that for 30 reps or 3 sets of 10. So next we have wrist flexion strengthening. So I'm gonna have you flip the arm over, and we're gonna do the same thing. We're gonna go up for a count of 1, and then slowly lower 1, 2, 3. Up for a count of 1, slowly lower 1, 2, 3. And again, we'll do that for 30 reps or 3 sets of 10.
All right, so next we have forearm strengthening with pronation and supination. So same thing, he's gonna keep the 2-pound dumbbell. What I'm gonna have you do, Barry, is hold the arm up facing to the side like so. You're gonna go up, back to neutral, down, back to neutral, and that's gonna complete 1 repetition. So again, we're gonna do 30 of those or 3 sets of 10. So our next 2 exercises should be completed after completing the previous strengthening exercises. So this is called a stress ball squeeze. With Barry, we use Theraputty just so that we can gauge and track the resistance that we're using from week to week. So Barry, I'm gonna give this to you, and what I want you to do is you're gonna squeeze, rotate, squeeze, rotate, and we're gonna do that for 2 sets of 10 or 20 repetitions. All right, so finally we have a nice little finger stretch. So Barry, what I'm gonna have you do is just relax the arm like you are. I'm gonna place this over these 4 fingers. And with the wrist in neutral, I just want you to slowly spread and come back in. And again, we'll do that for 2 sets of 10 or 20 repetitions.
So once again, the purpose of that program in combination with the TENS was to stretch and strengthen the muscles attached to the injured tendon to facilitate the healing process as well as promote muscle endurance and improve resistance to repetitive stress. A well-structured conditioning program will help you to return to daily activities, sports, and recreational activities, just like it has for Barry with golf. Thanks for watching.